Firewatch is a new program for first responders and military service members and veterans. Really what we've designed Firewatch for is a population coming together that has certain cultural norms that are different than the civilian population. They often experience or encounter things that might cause moral injury. And moral injury and healing from that is kind of the core of this program. Military veterans and first responders, like any cultural group, have their own set of values and norms. And because of that, there's this bond that occurs where you look at somebody who's a veteran or a first responder and you kind of just know that they know. The other thing that I've noticed about service members is this kind of call to protect civilians continues well after service. And what I mean by that is, you know, I'm a veteran, so I say we do things, we put ourselves in harm's way so that civilians don't have to do that. And when they're coming into a treatment setting, there's still this urge to protect civilians from the bad things that happen in the world. And so we find when veterans or first responders mix with a civilian group, they are reserved. They're not always sharing everything because they're continuing to want to protect people from those bad things. So putting first responders and veterans, military service members together allows them to share more freely because they're with a group who they believe and assume correctly have been through similar experiences. Firewatch is a unique program to Rogers because it's our first program that's population-based. We really put the program together with the cultural needs of veterans and first responders in mind. The VA is a wonderful resource for people who have VA benefits. And so we are here to supplement or augment the wonderful work that the VA is already doing and trying to reach those service members who maybe don't qualify for that care. Then there are veterans who work at the VA or who go to the VA for other reasons, maybe volunteer there, and they don't want to seek treatment from those same people that they might be working with in a peer collegial setting. And so we also can support those veterans who just need a different setting for their care. Similarly, with first responders, we've heard that sometimes it is really difficult for them to walk into a physical space where they might see people who they just supported on a call that night before, the week before. And so this program is unique in that it is in a virtual setting. So people can experience the wonderful treatment that we're providing from the privacy and safety of their home or another safe place. So they don't have to worry about that stigma associated with being seen in a physical mental health location. The beautiful thing about Firewatch is everyone working in the program either loves veterans or is a veteran themselves, and so they know intimately veteran culture. I think it's a wonderful thing because it's making this veteran's dreams come true. We're supporting veterans through work and their resilience and their passion, and then we're getting to heal other veterans, and so it's all coming full circle. So if you or a loved one has come back from service either as a military service member or a first responder and you're feeling withdrawn, you're feeling like you can't do those things that you want to do, attend your kid's soccer game, go on a date with your partner, if you're feeling that you're not good enough to be around people or you're not sure of your place in this world anymore, this program might be for you. And if you love a person who is experiencing those symptoms, the first and best thing you can do is listen, and then you can let them know that there is help and we will have their back.